Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, hosted by Skin of Color Society leaders and produced by HCP Live. I'm Dr. Jessica Mercer, board certified dermatologist and dermatopathologist in the Atlanta area, and I'm pleased to be joining you for Savvy Conversations. This episode, a topic that has shaped many, many careers in dermatology, and it continues to play a critical role in advancing care for patients with skin of color, mentorship in dermatology, building the next generation of leaders. I'm joined today by a longtime colleague and personal mentor of mine since the early stages of my career, Dr. Andrew Alexis. His work has really been instrumental in the field of dermatology as it relates to education, mentorship, and skin of color research. He's influenced countless lives, countless trainees, and clinicians across our field. So thank you, Dr. Alexis. I think you need no introduction, but I'll have you start by saying a couple words about yourself.
Oh, well, thank you, Dr. Mercer. I really appreciate your very warm and kind introduction. So I'm Andrew Alexis. I practice in New York City. I'm full-time academic dermatology practice at Weill Cornell in Manhattan, New York. And I've spent my career in that academic medical space and have the privilege of being able to teach and mentor students and residents and early career colleagues over the years. And continue to split my time between patient care and teaching and clinical research.
Well, I think the importance of a mentor is that you all really serve in a role that helps us to fulfill our goals. And you've done that, as I said, just so instrumentally throughout your career. But I want to hear from you the role that you think mentorship has in the field of dermatology.
Well, as I reflect back on my own personal journey into dermatology and beyond, just throughout my career, and then think of the folks that I've had the privilege of teaching and mentoring, it becomes very clear as you take a step back and look at the journey that none of us really got here on our own. And being able to have the support, the guidance, the inspiration as well from mentors and educators is just so critical in terms of having a successful career. So I'm personally very grateful for the people that have mentored me and inspired my career. And then I'm equally grateful that I've had the opportunity to then pass on some of the things that I've taught and some of the things that might be useful for my journey to the many students and residents and other mentees along the way. And I still have fond memories of many years ago when once upon a time you were also a student and visiting me in New York.
Well, you've certainly paid it forward because I will say a lot of my practice now is based on some of the patients that I saw when rotating and shadowing through your clinic. I see a fair number of skin of color patients. A lot of my work has to do with hair loss in my current practice environment. And I was introduced to that through mentorship with you, also with Dr. Susan Taylor, who ran the Skin of Color Society Center, Skin of Color Center in New York. And it really was a foundation for my career. I think it has really inspired me to feel confident treating patients who can be very challenging. And even throughout residency, I took what I learned in those mentorship and shadowing experiences, and that really helped to complement really what I learned even as a resident trainee. So thank you for that and your role in mentorship. So
Oh, my pleasure. And if
yeah.
I could just add to your comment there, you made me think of something about your experience. And it really emphasizes the point that through mentorship experiences, one of the potential benefits for a mentee is that you get to observe various clinical scenarios and approaches to patient care that in turn you can end up incorporating into your own practice in the future. And it can really spark an interest in a particular area, like for you in hair disorders, in pigmentary disorders, and other issues that are prevalent in skin of color. When you, for these mentor-mentee experiences, sometimes this is the first exposure to these areas, and it could influence and inspire a whole career in those areas that you can date back to those early mentor-mentee relationships. So I just wanted to emphasize that.
And I'm glad you mentioned that because as trainees, resident trainees, they practice all across the country with different demographics. And depending on where they practice and the clinical setting they're in, they may not have exposure to certain things. So I think mentorship plays a huge role in that arena. You being a mentor, but also serving in the academic space, tell me how mentorship can really supplement training for some of our students and aspiring physicians and dermatologists.
Yeah, thank you for that question. When we think about, as dermatologists, right, when we treat the various conditions that we treat, there's so many different approaches, right, to any given condition. There are multiple different approaches to the care of that patient. And one of the ways that we can learn different approaches that can be applied in different scenarios for the right patient is by being exposed to very experienced clinicians and learn from their varying approaches. And so that's something that certainly benefited me throughout my training and beyond, and something I like to impart to my current trainees and mentees, that we have different approaches, and you can, as a mentor, try to model certain approaches that yield the best outcomes for your patients, and hope that passes on to the person that you're mentoring, and it often does. And so what ends up happening, and I wonder if you agree with this, that you end up in your practice in the future, you end up incorporating a little bit of what you learned from mentor number one with a little bit from mentor number two. In this particular setting, you might have done a rotation in a different city at some point, and you learned something from that particular patient population. And so the more you see and the different patient populations and different environments and approaches, you can then have a broader range of techniques and approaches to pull from when you're seeing patients on your own.
Absolutely. A little of this, a little of that. And I think that really helps to build the way that we practice ultimately. One of the things that I said, to much is given, much is required. So now I also mentor trainees, which has been really just very fruitful for me. When I have a mentee who comes in, I like to ask them, what would you like to get out of this experience? Because I think different mentees require different things. For some of them, yes, they haven't been exposed to certain things and they want to practice amongst a different demographic. For others, it's their first introduction to medicine and they're a deer in headlights and they're just trying to really understand if they enjoy the medical field at all. So, when you have a mentee who comes to you, or what would be your suggestion for a potential mentee? How should they approach a mentee mentor relationship such that it's impactful for their career trajectory?
Hmm. I like the approach that you recommended, first of all, to establish at the beginning by asking the mentees what their goals are for the experience. But your question about, as mentors, what advice could I give to other mentors to ensure that our mentees have the best experience, or what can we tell our mentees? Perhaps your question was, what can we tell our mentees for them to have the best experience with their mentors? I'd say that it's really, you want to embrace the opportunity and take it all in. It's like drinking from a fire hose, and take every opportunity to learn from the mentor, not just in the scheduled time, maybe the clinical hours. Let's say the clinical hours are from 8 in the morning to 4:30 or 5 or what have you. Um, to approach it not just as an 8 to 5 experience or a 9 to 5 experience, but when there are opportunities after the last patient leaves, maybe the mentor has callbacks or reviewing the inbox of the patient inbox, or checking labs, or maybe having to do something academic or administrative afterwards. If it's appropriate and allowable and acceptable by the mentor, if the opportunity exists to stick around even after the official clinical hours, it's amazing how much you learn just in the observing after the last patient goes home. Not only do you observe other aspects of what it is to be a dermatologist, but also it allows for informal, less structured conversation and feedback and reflection on what you just saw that day. It's often a much better time period to have a conversation about maybe one of the interesting cases that you saw, or a burning question that you have from the day. It's usually a little bit more relaxed and informal outside the box of the official clinical hours. At least that's what I find in my experience.
That is
What do you think?
That is great info. So, to all of our potential mentees and mentees who are listening, that is, I think, one of the best pieces of advice that we can give the trainees. Because, like you said, it's a time where we have more ability to interact with that potential mentee. They can ask questions that may not be appropriate while in the exam room. And they see the real side of dermatology, right? The before and the after, and what all it takes to develop the knowledge that we have when we go in the room, what we deal with, the questions that we may encounter when that patient leaves. So, gosh, I think that's such an incredible piece of advice to give our mentees. So, thank you for that.
Oh, thank you. I'm glad that resonated. And I find that the mentees that I've had that have actually done this, their learning experience is much greater, and our bond as from mentor to mentee is a stronger one, and it turns out that builds a pretty good, even better foundation for a long-term mentor-mentee relationship.
Absolutely. So, another question I have for you is, do you feel like mentorship in some way translates to better patient outcomes for patients of color?
That's a great question. And I think absolutely yes, because when we think about, in particular, dermatology for skin of color, where there can be variations in terms of one's training and experience for treating pigmentary disorders, hair and scalp disorders, recognizing common inflammatory dermatoses across the range of different skin types. We all know that there are varying degrees of exposure and training to this. And so through mentorship, particularly if you're in a geographic location or a program that might not see a ton of hair disorders or pigmentary disorders or particular patient populations, doing an away elective or establishing an opportunity with a mentor to observe that mentor in their practice opens up the door to this whole spectrum of patients that you may not necessarily get to see as much of in the place that your home program. And so it supplements what you're training by going to a different place with a different set of patients, and particularly if you're with a mentor who has expertise in a given area, whether pigmentary disorders, keloids, hair and scalp disorders, et cetera, this in turn can improve the care of patients by exposing mentees early on in their career to these areas and instilling expert best practices for managing these disorders. And there's so much of what we learn that's not in the textbook. So I think that's really key. So you could read and read and read, which you must. It's very important. That's the foundation. But reading our textbooks, our journals, and so on, that's critical. But if you add the clinical experience and observing the experience of expert mentors, then you really have a deeper understanding of treating various dermatologic disorders. And so, for something like skin of color, where the literature and research continues to have some gaps, being able to supplement that with real world experience observing a mentor taking care of such patients, that really enhances the overall knowledge of that mentee, and they could take that through their whole career, build on that initial experience, and improve the care of the patients that they treat.
Absolutely. And I think when it comes to dermatology, especially, we see dermatologic disease present differently in different Fitzpatrick types. By Fitzpatrick type, I mean different skin complexions. For those who are not familiar with that term, and so that's why it's so important to have a breadth of training when it comes to different skin. Like you said, when it comes to different mentor experiences, different training experiences, because that helps to instill trust in our patients that we see in our clinical practices. Again, it gives you that extra foundation when it comes to your knowledge and your training. And I think that then turns us into experts in our care. So I think mentorship and this varied training experience is so very important. Do you have any questions for me, Dr. Alexis?
Yes, I'd love to hear about your current practice and how much your current practice and who you are as a dermatologist has been influenced by your prior mentorship experiences.
So I say every stage of my career has been influenced by mentorship, and I've just collected mentors along the way. I remember being a student at the University of Southern California, a medical student there, and when I initially started medical school, I thought I was interested in OBGYN. That was the path I was going down as I started medical school training, and I did my dermatology rotation. And I had gone through all the electives, like, oh, this is great. This is fun. I love this. I did my derm rotation, and really a spark came on. And I said, oh no, this is it. I love dermatology. Well, I'm toward the end of my third year, and dermatology being very competitive, most people being involved in research during their application process. I said, well, what am I to do? And I found a mentor in the then program director at USC, Dr. David Pang. And he said, well, if this is what you want to do, we got to figure a path forward. And he really gave me the hope and the confidence that I could have a career in dermatology. So, to your point, I really gave my all on the clinical rotation. I delved into dermatology, and I tried to spend more time with the residents and some of the faculty there to really understand what this career path looked like. And that was really one of my very early mentors. And then I ended up training at Brown University in Providence, Rhode Island, under the great Charles McDonnell, who really I think is one of the pioneers when it comes to skin of color. And he just had such a busy clinic, and really just very gracious in his teaching. But also throughout that department, I found a number of mentors. I also practiced, you can see the microscope behind me. I also practiced dermatopathology. And when I was training in that program, one of the brightest dermatologists, she also did derm path. And I said, well, even if I don't practice derm path, I think it will make me a better dermatologist, really. And just seeing her and with her mentorship and her training, I'm like, hey, I think my career will turn, and I'll develop some additional skills in this area. And that's how a career in dermatopathology was born. So this was not something that I had chosen for myself, but through looking at mentors, spending time with mentors, understanding what they did and how that shaped their practice, how that made them better clinicians, my career was also shaped. And I've named a couple of people that there have been so many people throughout my educational journey, too many to name. But like I said, you were one of those folks when I decided I wanted to do dermatology. You allowed me to spend time in your practice, in your clinic. Also, Dr. Susan Taylor allowed me to spend time in her practice, in her clinic. She, as we know, is the past president of the American Academy of Dermatology, but very, very instrumental in the skin of color space. So I've just been so grateful to be able to train under and study under and shadow under so many people who have been impactful. And it's really, really influenced my career. So, as you have done, I try to pay it forward. And I now have a number of shadows and mentees in my clinical practice now. So on any given day, there's someone attached to my hip, and I'm gracious to my patients for allowing them the space to learn, because that's, as we've discussed, that's what makes better dermatologists and better physicians. And so my patients have been grateful to play a role in their education. So I have students who come from some of the local institutions, anywhere from high school, medical school, residency training programs, but even the staff within our practice have served as mentees for me. We have a number. I'm about to lose three really, really strong medical assistants, and that's because, really, they are aspiring students, but they have learned so much, even just as working in the role of medical assistant, that has inspired them to move on to the next phase of their career. So I have two who are soon to be physician assistants, and some who've gone off to medical school. So I think, what we do is not in vain. So I want to thank you for the role that you've played, and thank you for really setting the standard also for me and what I'm doing in terms of mentorship, because we really see the fruits of that in the generations to come and the legacy that we leave.
Wow, that is so well said, and I'm really moved by that, and I love your enthusiasm for the mentorship that you've had and the mentorship that you are giving now as a dermatology leader, and it's just wonderful to hear how so many of your mentees have now gone on to medical school and residency and other great things beyond. And that really touches on the heart of mentorship. One of the biggest joys in one's career really is to be able to leave a lasting impact or expand the impact that we can have as dermatologists beyond one patient at a time, which is important too, but expanding it even to mentoring, inspiring, guiding the next generation of dermatologists through mentorship. So that was wonderful, Dr. Mercer. And by the way, we have a common mentor in Susan Taylor, and she was instrumental as far as my career. I had the privilege of being able to work with her when I was a resident and did an away elective at the Skin of Color Center in New York.
So generations have trained, and I think that's what we see. We pay it forward, and we see the legacy that leaves. So she has two strong legacies in us, and our mentees will be able to say the same. So thank you, Dr. Alexis, so much for sharing your insights and for the many ways that you have been committed to mentorship and education in dermatology. To our listeners, thank you for joining us for this Savvy Conversations episode because it has really encouraged some very thoughtful reflection on the impact of mentorship, not only on our careers, but how it relates to equitable care in dermatology, especially amongst skin of color. To learn more about Skin of Color Society and its mentorship initiatives, please visit skinofcolorsociety.org and be sure to follow Skin of Color Savvy on HCP Live for future conversations centered on advancing equitable dermatologic care. Thank you so much for listening, and thank you, Dr. Alexis.
Thank you.